next on, we have Roz Davies, who is a director at Thrive by Design. Thrive by Design is a multidisciplinary team hosted by Leeds and York Partnership NHS Foundation Trust, whose mission is to co-design inclusive digital innovation and improvement within health and care. And Roz specifically has 25 years experience of co-design and delivering social health and digital innovation across the NHS, the local authority and the third sector. And today Roz is going to talk to us and share some of her insights around digital co-production. So welcome, Roz.
Thank you, Lenny. I just also want to say that on a personal level, I live with type 1 diabetes, and I've done quite a bit of work with that hat on too. So, some formal stuff like being a governor on an FT, on a foundation trust, and sitting on research program panels and stuff, and also informal work. And I think it's really important to bring your whole self into the room. So there was a lot of sort of really important things that Holly said, and the answer to my question I thought was a very good one. It's recognising that we are whole people, that actually living with complex and long-term conditions and illnesses does have an impact on our mental and emotional health as well, and that needs to be addressed too. I'm going to share my screen. What I also wanted to say before I start as well is that somebody very early on in the chat talked about digital as an enabler. And I was sort of smiling to myself because that is actually kind of the crux of what I'm going to say, because everything that's already been said is relevant to the digital space. Digital is only a tool. It's just a tool to help us achieve the outcomes that we've been talking about. It's nothing more, nothing less. So all of the stuff that we've already heard is relevant to digital, or to the digital space, I should say. So I'm going to try and share my screen. So what I've put together here is really kind of some, recognising all the things that have already been said are relevant to this space. So I don't want to repeat that, but I want to talk about kind of some of the things that we've learned, some of the examples of work that we've done and other people have done, some of our thinking, and then there's some tips and tools in here as well. I won't go into detail on every slide because I'm hoping that you'll all get sent it and then you'll find what's useful to you in the slide deck. I'm a big fan of sort of takeaways as well as presentations. So I'm just going to kick off. So I think the first thing I wanted to say, coming back to that outcomes thing, and us being whole people, is one of the definitions of health, which has stuck with me for, I don't know, something like 15 years ago, I think I found it, is the Aboriginal definition of health. And the reason why I think it's really important as a starting point is because, one, it recognises that physical and social, emotional and cultural well-being, so our whole selves. And the other thing that it recognises is how important the health of our community and the community we sit within and our connection with community is. And I think we should always be thinking about that. And I wish that we would sort of almost dump the WHO definition of health and pick up this one, because I think it's much more holistic, and it certainly seems to chime and resonate with some of the things that you've all been talking about and saying and chatting about in the chat today. So so I've already talked about what I'm going to go through. So I'm going to give you a tiny bit of background on Thrive, because I think Lenny did quite a good job for me there. And then I'm going to talk about digital in our context, so in health and care, and then co-design and co-production, because I think we ought to sort of be honest about where we're at in this spectrum. Some examples, and then, as I mentioned, some top tips and links. So I just wanted to say that we are very proud to be part of the NHS. So we're hosted by Leeds and York Partnership Foundation Trust, which is a mental health and learning disability and autism trust. But we sit on the edge of that trust, and we work with people up and down the country who share our ideas and our values and our mission. And as Lenny said, we're all about looking for and learning about co-designing inclusive digital innovation and improvement. And what we're really focused on is tackling inequalities, whether that be through digital innovation or by making sure that we don't compound pre-existing inequalities with the digital transformation of health and care. And that's even more relevant from the last couple of years. So we have really benefited from having that tool digital over the last couple of years. Many of us have used it to socialise, to buy our shopping, to apply for benefits and so on. But the problem with this rapid digital transformation in health and care is that actually there's a massive big flaw in planning, that there's a whole set of people who actually can't easily access digital. And I think we need to acknowledge this from the start. And those people are more likely to be older, living with disabilities, living in poverty. So those people are more likely to need health and care services. So there's a big flaw in the plan if we ignore this as we go through this digital transformation. And what we've been working on is recognising that digital isn't going to be for everybody. And if we actually sort of race ahead and transform our services digitally without understanding, without talking to and listening and working in partnership with people who are more excluded, we're going to end up leaving people behind. And there is a sort of, there's quite a lot of work done around digital inclusion, and we think that's really important. But we think actually the real problem is not individuals. So it's not about necessarily only building up skills and access and so on of individuals, but actually we're designing an exclusive system if we don't actually work in partnership with people. So we're interested in how do we change the system so we actually co-design without those fences in from the start of the game. I'm not going to go into great detail on this, but we've done quite a lot of work over the last couple of years with over 16 integrated care systems up and down the country, trying to find out, what does it look like when we actually co-design inclusion into digital transformation? And these are some of the factors that have come up. And just to point out a couple of them, first of all, leadership. It's really important that actually senior leadership understand exclusion, understand inclusion, and actually put the weight of their support behind it. Another part is that, which we've heard a lot about today, is recognising the assets and people and what we already have happening in our communities and connecting up with that. And another part is around working in partnership. So I'm really lucky to have worked in all three of those sectors that Lenny mentioned, so the NHS, local government and the voluntary sector, because I can see value in all three of those sectors working together, pooling resources, pooling insight, pooling understanding to tackle exclusion. And then most importantly of all is actually co-designing or co-producing, ideally, in partnership with people. These are just some examples of some of the work that we've been up to. So you can find all this stuff on our website or whatever. But we run a Mindworld, which is an information platform for people living with mental health illness in Leeds. There's a mental health and digital inclusion guide. We've done digital inclusion blueprints. One of my favourite things that we've done is work with children and young people with autism and their families to co-design a prototype for a digital sort of app, if you like, to help people share their social and communication needs with services. And then there's a sort of mapping tool in the corner there. So digital in our context. So here we go. Here's the breadth of digital in our context. It's all sorts of things to all sorts of people. The picture in the bottom right corner is actually a Libra sensor. It's something that I use, which helps me to monitor my blood sugar level constantly. And the clinicians that support me are able to also access that data, and we can sort of have really informed sort of mutual conversations and co-produce the right kind of support for me. So what is digital in our context? And I think there's sort of three key points I wanted to make here. First of all, and this, there's all sorts of definitions of digital health, and it's impossible really to define it fully because it keeps changing over time. And it's lots of different things, but here's one definition. So it really shows you the breadth of what we're talking about here. Sometimes it's about the sort of internal infrastructure of how we run our services, it's apps, it's wearables, it's AI and data, it's all sorts of things. The second point, which is the most important point I think I'm going to make, is that digital is only an enabler. And actually, NHSX nearly got it right here when they talked about using technology to support health and care professionals, to communicate better, to enable people to access the care that they need, and so on. I think they kind of stopped short, really, but they started off in the right direction. And these last 4 points, I wanted to sort of share these with you because this is what Sajid Javid said last week as his plans around digital. I don't know about you, but I think he's sort of underestimating the complexity and the human side of digital here. But, you know, this is important to understand in terms of the direction that he's heading. I mean, he's talking about, he talks about levelling up, but what he means is he wants to get all the health and care systems to all be having an electronic patient record. So that's 227 trusts, 7,000 GP practices, 18,500 adult social care providers, and 400 different IT systems. Shall we wish him luck with that? Oh, by December 23. So, but the point is, we must understand that this is complex, and actually digital is really all about people. And here's some examples of where it's gone wrong in the past. So we won't go into detail on the COVID track and trace app, but you probably all know about that. And also the idea of paperless NHS. I think that's been going on for 20 years and lots of targets have been missed along the way. And I just wanted to give you those examples so that you sort of have that question, you know, what went wrong there and how could there have been a more successful approach? And I think you might know what the answer is given the title of this conference, or at least one of the answers. And then the big sort of thing here is about not letting the digital tail wag the dog. And I'll go into that in a bit more detail in a moment. So digital is an enabler, not the end goal. So I think the important thing here is about starting with desired outcomes, shared purpose, and then coming backwards and going, okay, how can digital help us? So what we don't want to do is go, let's have a digital electronic patient record system without knowing why we're doing it. What's the point? And this is a really good example of how that happens. And it also is a good example of showing that digital isn't all sparkly, shiny things. It can be very basic and actually make a really big difference. And in this case, it saved lives. So this is an example from the NHS Widening Digital Participation Programme, which was commissioned by NHS Digital and run by Good Things Foundation when I was there. So the goal was about increasing the uptake of breast cancer screening in disadvantaged communities. A piece of co-design and user research, so this isn't co-production, this is co-design, was carried out to understand, you know, the context and people and so on. And they realised that the communities were using Facebook. So the answer was to go to where people are, and I think that's a golden rule of community development, to go to where people are and engage in a way that's meaningful to them. And actually the result was they increased the attendance by, or the breast screening rates by 12.9%, which meant that they were saving lives. So that's an important kind of approach to digital. And this is a bit of a sort of spectrum of what happens in digital around, you know, heading towards co-production. So, you know, you start off with tokenism, so there's surveys and participation groups and forums and so on. And I think this applies to offline as well as online. And then there's a whole section around user research, co-design. And I'll be honest, I think my team spend most of our time in the co-design sort of area. And then ultimately, you know, the gold standard is co-production. But on a personal level, I don't actually think, I think we rarely achieve co-production. It's about, you know, if we're talking about shared purpose and power and responsibility and so on, there's always sort of, you know, the world that we're in, the dynamics that we work within, you know, there's a power dynamic that we need to be honest about, really. So, and here's, you know, this is a sort of taken from Sticky Notes blog, which is a brilliant blog to follow if you want to learn about digital design and co-production and so on. But Kellyanne has put together a bit of a table here, which describes in a bit more detail that tokenism, user research, co-design, co-production spectrum. And here's some examples, some digital examples of that. So anyone in the NHS and probably local government who's used Oracle will realise that wasn't developed, you know, with co-design. It was developed back in 1977, and sometimes it still feels like we're back there when you're using it. The NHS app, a lot of user research went on, goes on behind all of that, but I think that's probably about where it stops. I'm going to give you an example of Sheffield Flourish, which I think was a sort of co-design and participatory design example. And then there are actually some co-production kind of digital examples as well, which were led by community. And one I don't know if anyone's heard of, but is Nightscat, which is the one that I'm really particularly interested in, as it's about diabetes, but I'll talk about that in a moment. Important. I think the important thing to understand all of this, so whatever methods we're using, it's, to me, co-production is about power. And we need to understand it's the how, sometimes not the what, the intention, the power and decision making and so on. And this is quite a good sort of frame, which I'm sure many of you who've worked in community development will recognise, around power over, power to, power with, and power within. These are the co-design principles that we use. So I think they're sort of heading towards co-production, but I think they sit sort of in co-design. But it's about designing with people, not for them, going where people are, recognising that this isn't, like, quite a lot of digital stuff is very transactional, and actually this should be about relational. And working out in the open, being honest, transparent, and so on. I think we heard that quite a lot with Donna, which amazing presentation there. Understanding a lot and underlying behaviours, so not necessarily, looking actually on the root cause, what's happening behind the scenes, what are people's context, and doing it now. So often the problems that we're sort of, tasked with solving are very big, tricky, thorny, complex problems, and you can sometimes. People sometimes put them in a corner because they can't deal with that. But actually, what we believe in is starting now where the energy is with what we have and moving from there. So I'm not going to go into this, but this is basically co-design sort of methodology. So understand, define the problem, sort of build ideas around that, prototype, test, and then go back to the beginning and iterate and develop over time. So that will be hopefully useful to you when the slides do get circulated. I can see someone asking a question. So some real world examples. So I was the managing director of Sheffield Flourish back in 2015, and we had an idea about co-designing a platform which would enable people with mental health illness in Sheffield to live well. And this was actually not defining people by deficit, but actually recognising people's strengths and talents and ideas, and recognising that is part of recovery and managing mental health. So what happened was that we started by asking people with living and learnt experience together the same question: what matters to you? What do you need to live well? And they said things like, they didn't talk, the only person in the room that talked about any kind of medication was me, because I love diabetes and around insulin. But everybody else talked about things like community, information, having their voice heard, and so on. And there's some really good examples there. I'm realising I'm running out of time as well, so I'm rushing a bit. Anyway, it's a really successful kind of piece of co-design. Have a look at it. If you Google Sheffield Flourish, you will find that. This was a project that we've just completed, where we worked with young people to co-design a digital solution to help prevent people from actually ending up in inpatient care and mental health inpatient care, so CAMS. And young people actually changed the course of this piece of work. I would say it's more co-design because the task was given to us by a National CAMS Task Force, not young people. But young people came into the room and they said, actually, you're focusing on the crisis point, and we think you need to focus on pre-crisis. Actually, crisis point is too late. So they actually changed the whole focus of the piece of work. They helped co-design a fantastic prototype, and then they presented that back to the National CAMS Task Force. And I think there's going to be legs there because they own it. The power was in those people, young people themselves owning that and changing the course of the piece of work. And then this one, I'm just going to very quickly tell you about this one. So basically, a group of parents who have children with type 1 diabetes recognise the importance of basically closed loop systems, so really being able to understand and have all your data, but also to be able to remotely monitor that and be able to support their children with that. And they asked for help. They asked the industry, they asked the public sector, got nowhere, so they decided to sort it out themselves. So that was co-production, I think, pure co-production, and it's now a really sort of renowned and well-known resource. You can Google that as well. If you look at the hashtag We Are Not Waiting, you'll find it all over Twitter as well. So these are various tips and things to try out with in terms of the like nice little tools and so on. Some useful links for you. I'm going to stop there. I've rushed through that. I'm so sorry. I've probably put too much content into there, but I hope you'll find that useful. And really, sort of coming back to the key things around: one, digital is only an enabler. It's a useful support tool. It can help overcome inequalities, but it can also get in the way as well. And what we need to do fundamentally is co-design in partnership with people. And I'll leave it there.
Thank you very much, Roz. That was a great presentation. And I think, as you've said, it's a huge field with lots that we need to learn. And you talked about how we rapidly accelerated into digital, but actually there's still a lot that we need to understand about it. And I think that might lead us into, again, some people are asking some really big questions. So I'm going to ask you the really big question here, Roz. And I think some of what you've said has already started to answer the question. But the question is, how do we design systems? Because there's a lot of systems and platforms being created by different services that often are trying to do the same thing. But the question we've got is, how do we design systems that can serve multiple purpose for the community? An example they've given is that police and council, etc., often appear to be attempting the same work, but it can confuse communities in terms of where do they access, what do they do, it looks different here and what have you. So the question is, have you got any examples of working with partnerships where these resources are aligned so that they create platforms that service whole needs of individuals and communities rather than those sections and segments?
I mean, what you're asking for there is the holy grail, isn't it? and many people much cleverer and more wise than me have been sort of grappling with this for many, many years. And I think, it's like a lot of these problems that what we need is a sort of North Star, if you like. This is what the ideal would look like. And we all need to have that sort of shared picture. And then we kind of chip away and head towards that. And because otherwise, if we there's always this dilemma, isn't it? If we spend years and years sort of designing the very perfect thing without doing anything, nobody benefits from anything. So, we don't get anywhere basically, because it's, perfection is not possible. Having said that, I think there are some fundamentals that we've heard already today that would help us, go in that direction. So first of all, it's, getting everybody who's got a stake around the table together in a way that is authentic, where everybody does actually have a say, and where voices are heard, making sure that you don't miss out on what is sometimes called seldom heard communities that are really important here, and so on. So the first step is to get everybody around the table listening, understanding, and so on. And I think then there's, let's build shared purpose here and build a shared sort of relationships of trust as well at the same time, and agree a plan together, pool resources, and sometimes it'll be, okay, we know where we want to get to, we know where we are now, what are the kind of steps that we could do to do that, but we won't know everything from the beginning. So it might be that everybody's agreed that, but I don't know, in a half year's time, somebody finds out about, I don't know, a practical bit of funding, or there's an opportunity to change something that then will help it to sort of get closer to the North Star. So I think it's, having a set of principles, a shared vision, relationships of trust would get us a long way in that direction.
And I think that's one of the things you mentioned there, which really resonated with me, was that chipping away. We often try and design something before we launch it, and by that point it may not be right, or things have moved on. But I think there's something, again, getting the people together, and I think a lot of people have been asking for, if your presentation will be sent to them, and all presentations will be sent. And I think some of these slides in there show that process of ideation and iteration, as you said, so that we actually start to build. And as the more we learn, the more we can get closer to that North Star.
There's another part as well that's quite important, and that's sort of really quality improvement, I guess. But it's about constantly reviewing and checking back and getting feedback. Opening it out so everybody is able to feedback and input into it. Because what I've learned in all of the work that I've done is there's incredible people doing great things. In every integrated care system, if you open it out and you ask the question, you will find amazing sort of people, organizations, facilities out there that will help contribute to it. So allowing, opening up the system and enabling that sort of constant feedback and input and support will also sort of, it's a kind of social movement stuff, isn't it?
Great. Okay, thank you very much for your time, Roz. That was a great presentation. And again, the comments in the chat, people are really interested in that, and really interested to probably have a more in-depth look at your slides when they are sent out.